Hi, everyone. I'm Kevin McGarvey, CEO and co-founder of Hippo Health. As many of you have experienced personally, and as I experienced as a physician, the modern-day healthcare experience is broken, in part due to lack of connectivity and easy communication between care teams and patients. To understand why, I need to take you back to medicine's roots. Let me tell you about an old guy that lived 2,500 years ago. His name's Hippocrates, and he's still making an impact today. Every physician takes an oath to take care of every patient like a human being. But unfortunately, healthcare has gotten way complicated, leaving patients and clinicians often disconnected. Within that problem is a deeper problem. Today, independent medical groups are getting killed, where they're losing patients to urgent cares, convenience clinics, competing health systems because they don't have the capacity to see the patients that they have in their census in a timely fashion. They're an antiquated technology and on EMRs that don't talk to each other. We offer a solution that allows them an easy, simple way to talk to their doctor, but not just talk to their doctor, but their entire care team, and allows them to also talk to other doctors in the community and their care teams to create easy care collaboration. Our solution offers a simple SaaS platform that's low cost and cheaper than anything on the market to interconnect medical teams in a new way. And then we layer on additional services with integrated virtual urgent care to allow those groups to offer new, convenient walk-in capabilities to their patients so they can now say, we're the doctors that know you and we can see you right now. And when they're at capacity, we can see them on backup and refer back to their primary care clinics and their specialty clinics, working within their EMRs and their own clinical pathways. We started a year ago with Peak Orthopedics in South Denver, and we were able to help increase their clinic revenue by 36% by monetizing unreimbursed phone calls and helping them triage low acuity visits to telehealth, helping them decompress wait times and see new patients that were higher acuity and were often requiring procedures, with 99% of patients stating they'd recommend the platform to their friends and family. With that initial work, we started to get drawn into a really perfect product market fit with independent physician associations. These are groups of independent medical groups, usually 200 physicians. There are 700 across the country. They're all on antiquated technology, typically not on easy working communication flows where they can refer and keep people in narrow networks with network integrity. And we think this represents a $2 billion opportunity as our go-to-market. Why now? We think the pendulum is ready to swing back in favor of independent groups in the outpatient setting, where with integrated technology and care communication, we can deliver better care at half the cost with committed physicians who are owners in their practice. We're working and talking with these groups here today in Colorado. Our current offering, and we're focused on keeping it at this price, $15 a professional a month. So lower cost, cheaper than Zoom, and better than Zoom. Then we layer on additional services and technologies to augment the care experience. Our first offering is integrated virtual urgent care, where we have a team of 8 top emergency physicians here locally that have all worked together for 15 years that can provide backup coverage and integrate with local clinics to be able to provide a new way to deliver population health. Our platform today is a simple user interface that allows for automated care team connectivity with automated prompts and easy, secure messaging that you can provide between your care team members and your patients, as well as HIPAA-compliant video that can also then jump into imaging review to give patients a real experience, just like they were there in the clinic. We started with Peak Orthopedics in South Denver 1 year ago. At the end of last year, we enrolled Spine West, a top physiatry group in Boulder. And then we brought on Coal Creek Family Medicine and Transitions Healthcare earlier this year. Upon completing Boomtown Health Tech Accelerator, which is affiliated with our main medical malpractice insurer, Copic, we've subsequently brought on true community care hospice, and altitude physical therapy with clinics up and down the Front Range. And this month, we're enrolling our first IPA, Integrated Physician Network, with 140 physicians, Westside Behavioral Health with 60 mental health providers, and the top neurosurgical group in Boulder Neurosurgical, to create a true local care network where we're seeing network effects take place with inbound sales and conversations happening every day now for partners in the community that are committed to serving their physicians in a new, innovative way that can be half the cost of what patients are facing today with modern day healthcare. I took an oath as a physician to serve my patients, and today I make an oath to all of you to create a better care experience so you, your loved ones, can feel cared for in modern day healthcare. Thank you so much.
Thank you, Kevin. Questions from our judges?
I had to formulate my question. You want to go first?
Yeah, I'll go first.
Yes.
Hey, thank you for your presentation. My question is, you might have mentioned this, but I didn't catch it clearly. Who's the payer? Are you able to bill insurance companies or not?
We
if
can.
not, are the patients paying right now, or who's the payer?
So we bill typical fee for service right now. I think there are a number of different payment models we can do with the architecture of the platform, but we're a parity state, so we've been collecting reimbursement from private payers, typically $70 to $100 per encounter.
And that's under, what do you mean by like, is that under telemedicine?
Yes.
Okay, that's what you mean by parity. Okay, got it.
So I understand the portion about the backup providers,
Yes.
but your initial statement was the idea of getting people back into their clinics, if I understood correctly. So it's my question is, for the initial group of patients that could be seen by their own providers through the telemedicine service, you're still dedicating provider time for that. Is that correct? So, I'm a doc. I work in a clinic with 3 other colleagues, et cetera. Every minute I dedicate to this is still time I'm not working with my patients who are physically in my office. What's the solution there?
I see what your question is. So the problem we identified in interviewing about 100 physicians and care professionals in the community is that the wait times are still significant where patients are leaking to urgent cares and convenience clinics for primary care docs and outpatient specialty groups. So we offer the platform to those groups, and they can then say to their patients, you can walk into our clinic, or we can see you virtually on walk-in. And if you're at capacity, then we're on backup. And so we estimate that a primary care group loses 2 visits a day per primary care doctor to urgent cares and convenience clinics. And we think that represents an opportunity that could grow an IPA by about $10 million in annual revenue every year.
Thank you. I had a question. I saw the section where there was a chat function initially, right? And then it transfers to a video.
Mm-hmm.
Is that for every single patient? Is that chat function just for a triage? Does it have an algorithm attached to it that gives the doctor some idea of what the patient's here for and triage them to a certain level? Or is it just really used for gathering triage information?
So the way that we use the tool right now with secure messaging is I could send you a text, and you could download the app and create your own care team, and then you could create patient accounts by sending your patients a text on the platform. They'd be on the platform about 3 minutes. And then when they join in, they click Talk to a Doctor Now, you get an SMS text to your phone that says you've got a new patient. You enter into that visit, and you can either immediately go into video, or you can use what we call prompts, where you're walking around, going about your work, and you don't have time to type like, hi, how are you? I'm Dr. McGarvey. How can I help you today? We've got prompts where you can simply ask the common 8 to 10 questions to automate the process. And then as you collect information, that's in your hands really on how you decide to escalate into video.
In general, are all of these leveraged into video, or can you actually charge for chat? We don't come.
We
from
don't charge from chat. Yeah,
Okay,
yeah.
only the
So
video.
so our best practice is basically face-to-face video. Is on par with collecting with private insurance right now. There are a number of laws that are taking place with Medicare around texting, but our bread and butter right now is video chat.
I've seen other companies that obviously can come in and want patient engagement and offer video chat features. Other than price, what advantages do you have over the
Right.
competitors?
That's so our real innovation is actually the business model. It's not the technology. So our innovation is that we're interconnecting top committed independent groups in the community where we believe that's what patients really want. They want doctors that know them, and they can trust. So we're selling directly into those groups who are then using the tool basically as they see fit. And we've seen great uptake from that model. Thanks.
All right, Kevin, thank you so much. Appreciate it. Hippo Health. I'll take